Alright, so first I'm going to start off by going to a quiet place with no distractions and checking the patient care order form and the MAR to make sure I have the right patient. So I have Jaguar Jones and Jaguar Jones. Then I will check the order on both of them to make sure that they're the same. So I have morphine sulfate 5 milligrams intramuscularly every 4 hours PRN for pain, and morphine sulfate 5 milligrams intramuscularly every 4 hours PRN for pain. So now we'll do the 5 rights of medication administration. So I'll make sure I have the right patient, which is Jaguar Jones and Jaguar Jones. The right medication, which is morphine sulfate and morphine sulfate. The right dose, which is 5 milligrams and 5 milligrams. The right route, which is intramuscularly and intramuscularly. And the right time, which is every 4 hours PRN for pain and every 4 hours PRN for pain. I do notice that he has an allergy to penicillin on both the patient care order form and the MAR. So now I'll perform hand hygiene and select the correct medication, which is morphine sulfate, and it matches with the MAR, which is morphine sulfate. And the expiration date on the vial is 3/20/2020, so it is out of date, but we're going to act like it's not out of date. The correct time, which is every 4 hours PRN for pain, and he has not had that today. It is going to be done intramuscularly, so I have the correct syringe, which is the 3 milliliter syringe, and the correct needle, which is the 23 gauge needle, and I also have the blunt tip cannula to draw it out of the vial. He's getting 5 milligrams of morphine sulfate, but it is in 10 milligrams per milliliter, so he'll be getting half a milliliter of morphine sulfate to get the correct dose. So now I will clean the top of the vial with an alcohol swab. Then I will draw half a milliliter of air and inject that into the vial. Then I got all the air bubbles out, and I have half a milliliter of morphine sulfate. Now I'll recap the blunt tip cannula and dispose of that in the sharps container. So now that I have the 23 gauge needle on the syringe, I will get another nurse to check the correct medication and the correct dose and recheck any of my calculations that I did. So now I will make a label for the syringe. I'll check the correct patient, which is Jaguar Jones. The correct medication, which is morphine sulfate. And the correct dose, which is 5 milligrams. And then I'll also check that it is the right time, which is every 4 hours PRN for pain, and he's not had it yet, and it's being done intramuscularly, and I have the correct syringe and needle for that. Now I'll go into the patient's room and I'll perform hand hygiene. Then I will do the 2 identifications for the patient. So I have Jaguar Jones and Jaguar Jones, and the date of birth is 8/25/1963 and 8/25/1963. I see that he has an allergy to penicillin on the MAR and also the wristband. So I will ask him if he has any other allergies and what kind of reaction he has to penicillin. So then I'll do the 5 rights of medication administration again. So I have the right patient, which is Jaguar Jones, the right medication, which is morphine sulfate, and he's getting 5 milligrams which is on the MAR and in the syringe. It's being done intramuscularly, so I have the correct syringe for that, and it's every 4 hours PRN for pain, and he has not had it today. So now I will explain the procedure to the patient. So I'll be giving an intramuscular injection of 5 milligrams of morphine sulfate. So now I will raise the bed and lower the side rails, position the patient comfortably for the procedure. So before I start the injection, I will palpate the area and check for any bruising or tenderness, and he does not have any. And I will clean the area of injection in a circular motion. And then for an intramuscular injection, I will inject between the 2 fingers while spreading the skin. And then I'll inject at a 90-degree angle. And I'll aspirate for blood return. And then I do not have any, so I will inject slowly. And then wait for 10 seconds. And then pull the needle out and apply gentle pressure. I'll dispose of the syringe in the sharps container, and then so now I will inspect the patient for any allergic reaction and document how the patient responded to the injection. Then I will lower the bed and raise the side rails and position the patient comfortably. And the documentation is the 6th right of medication administration. Then later I would come back and assess the patient for any other reactions. And then after I take my gloves off, I would have done hand hygiene.